All right, guys, so right now I want to focus on another condition, something we call pulmonary edema. Okay, so pulmonary edema happens when the patient's fluids are escaping the vascular system, and for some reason or another, they enter the alveolar sac, the respiratory system. And think about it, folks. What's going on? What are the lungs supposed to be doing? What's the purpose of the alveoli and the bronchioles, right? The bronchioles transport air into the alveoli. The alveoli, the healthy alveoli, expands. Semi-permeability occurs, meaning the gas exchange. And then we have the healthy patient with enough oxygenation to perfuse tissues and the adequate elimination of CO2 to get rid of the metabolic waste, right? But in pulmonary edema, something has happened. You have the bronchioles right here, and you have the alveoli that are now congested with fluids. And this is causing a significant problem, because when somebody has healthy alveoli, we have the capillary system right here that's supposed to be allowing for gas exchange. But now that we have this issue of pulmonary edema, we have a bunch of fluid inside, and it's getting in the way of the gas exchange. So again, it all goes back to the same basic concepts: impaired gas exchange. So guys, what happens when you have impaired gas exchange? You have low oxygen levels, which we call hypoxia, and we have increased CO2 levels, which we call hypercapnia. These are very important basic concepts that are going to be applied to any condition where the gas exchange is impaired. You guys have to know that, okay? But now so we can understand that this patient is going to be dyspneic, they're going to have shortness of breath, they're going to have exertional dyspnea. When they become physically active, they get really tired really fast. What do we do to promote the elimination of CO2? Pursed-lip breathing. So if you guys have seen my previous videos, you understand it. You start seeing the picture that the concepts are generally speaking the same when it comes to impaired gas exchange. But now we have an added element. We have pulmonary edema. We have all this fluid inside that we have to get rid of. Let's address one more thing first. When you have pulmonary edema, what ends up happening is that the blood vessels, let's talk about the veins, let's talk about the arteries, okay? They contain blood, and blood is also made up of plasma, the water component of blood. Well, that fluid is escaping the vascular space and it's going inside the alveolar sac. What we're doing is we're losing fluids from our systemic circulation. This causes our urine output to decrease. Okay, so people that have pulmonary edema, aside from all the respiratory signs and symptoms that we've been discussing and exploring so far, we're also going to have, need a better marker. We're also going to have a decreased urine output, okay? Because the patient's retaining fluids. When we have pulmonary edema and we have retention of fluids, you have to provide the appropriate position to allow the patient to breathe better. So keep in mind that if we have a lung and if we have some fluid inside, if the patient's sitting up, if the head's up here, well, the fluid goes down to the base of the lung, which allows for better room for gas exchange. A larger volume of the lung has less fluid now, assuming we sit the patient up. So the best position for a patient who has pulmonary edema will be high Fowler's, the higher the better. But at least the head of the bed has to be elevated to any degree. We don't know what they're going to ask you. So the concept is the head of the bed has to be elevated. And then when the patient is with their head elevated, the fluid goes down to the base, which I discussed, more volume for the gas exchange to occur. What happens when the patient lays flat? That's when they develop orthopnea, or the inability to breathe as they're laying flat. Let's review that term again. Orthopnea. The inability for the patient to breathe when they're laying flat, because then the fluid encompasses more of the volume of the surface area, the volume space of the lungs, which impairs in gas exchange. Now, since we're discussing that the fluid escapes the vascular system and it enters the alveolar sacs where they're not supposed to be at, we have decreased urine output. We have to provide interventions that allow for the elimination of that fluid. And now we start talking about medications. We can give furosemide. We can give hydrochlorothiazide. These drugs will help with the elimination of the excessive fluid that the patient has, so we can promote better gas exchange. Okay, guys? So these are the primary issues that you guys are going to be finding when somebody has pulmonary edema.